Hello, my modern and unstoppable seniors. Welcome to Wellness for Modern Seniors, your go-to channel for staying strong, healthy, and vibrant as you age gracefully. Today, we're diving into a topic that could literally save your life. Have you ever felt a strange, unexplained feeling in your body? A subtle whisper or even a loud alarm that something just isn't right? Sometimes our bodies send signals that we might be tempted to brush off. But after 60, those signals can mean a lot more than you think. Doctors around the world warn that there are 6 deadly symptoms seniors should never ignore. Ignoring these signs could lead to serious, even life-threatening situations. But here's the good news. By recognizing these symptoms early and acting quickly, you have the power to protect your health and take control of your future. In this video, we're starting with one of the most common yet overlooked symptoms: unexplained extreme fatigue. What is unexplained extreme fatigue? Now, we all get tired. That's normal. But this is different. Imagine waking up after a full night's rest and still feeling like you ran a marathon, or struggling to get through simple daily activities like dressing, cooking, or even having a conversation because you're just completely drained. This kind of fatigue doesn't come from working hard, stress, or even a poor night's sleep. It shows up suddenly or gradually and sticks around, no matter how much rest you get. Why does this happen? After 60, our bodies are naturally changing. That's part of life. But when fatigue feels extreme and unexplained, it often means your body is struggling on a deeper level. Maybe your heart isn't pumping as efficiently as it used to. Perhaps your kidneys are under stress. Or your body could be fighting a serious illness, like cancer or a chronic infection. Sometimes your organs have to work overtime just to keep your body functioning. Doctors see this pattern a lot in patients with heart failure, kidney disease, or even advanced cancers. The fatigue isn't just feeling tired, it's your body sending a distress signal that something needs attention. What does this fatigue look like in real life? You used to enjoy your daily walks, but now even a short stroll feels exhausting. Simple tasks like making a meal or getting dressed take so much effort you want to skip them. You find yourself needing to rest multiple times a day, yet the tiredness never fully goes away. Why you should take this seriously? This isn't just getting older. It's your body's way of asking for help. If you ignore this kind of fatigue, you might miss early warning signs of a serious condition that could become life-threatening. What should you do? Start paying attention to when the fatigue started. Does it come on suddenly, or has it been creeping up? Is it interfering with your daily life? Are you feeling weaker than usual without any clear reason? If you answered yes to any of these, it's time to take action. Talk to your doctor. Don't wait for the fatigue to worsen. Early diagnosis can make a huge difference. Whether it's adjusting medications, treating an underlying illness, or making lifestyle changes, catching the cause early can help you feel better and live longer. My modern and unstoppable seniors, your energy is precious. Don't let unexplained fatigue steal your spark. If this is something you or someone you love is experiencing, don't hesitate. Get checked out. All right, my modern and unstoppable seniors, let's talk about something that demands your immediate attention. Sudden, severe chest pain or pressure. This symptom is one of the clearest red flags your body can send, and it's not something you ever want to ignore, especially after 60. What does severe chest pain feel like? This isn't the occasional mild discomfort or a sharp jab that fades quickly. This is a heavy, crushing sensation, like a weight or tight band squeezing your chest. Sometimes, the pain can spread beyond your chest. You might feel it in your arm, your jaw, your neck, or your back. It may start suddenly or build up quickly, but either way, it's urgent. Why is this so dangerous? Doctors warn that this type of chest pain can mean one of two things: a heart attack. When blood flow to the heart muscle is blocked, the heart starts to suffer from lack of oxygen. This is an emergency that needs fast action to prevent serious damage or worse. Aortic dissection. This is a tear in the largest artery in your body, the aorta. It's less common but incredibly deadly without immediate surgery. The common mistake many seniors might brush off chest pain, thinking it's just indigestion, heartburn, or muscle strain. But this mindset is risky. Heart attack symptoms don't always look like the dramatic chest-clutching scenes from movies. Sometimes it's just mild discomfort, nausea, dizziness, or sweating. Important warning signs to watch for: crushing pressure or tightness in the chest, pain radiating to the jaw, neck, back, or arm, usually the left arm, shortness of breath or difficulty breathing, cold sweats, nausea, or feeling lightheaded, sudden weakness or fainting. If you experience any of these, do not wait. What should you do? If you or someone near you suddenly feels severe chest pain or pressure, call emergency services right away. Don't hesitate. Don't try to drive yourself. Don't lie down and hope it passes. Stay calm, sit down, and wait for help to arrive. Remember, minutes count in these situations. The faster you get medical care, the better your chances of survival and recovery. Why it's important for seniors after 60. Your risk for heart disease and other cardiovascular problems increases significantly. Your arteries may have hardened, your blood pressure might be high, and your heart may be working harder than before. Because of these changes, chest pain or pressure could signal something very serious and should be treated like the urgent red flag it is. My modern and unstoppable seniors, please take this symptom seriously. Not just for yourself, but for your loved ones too. Spread the word, because knowing what to do could save a life. Now, my modern and unstoppable seniors, let's focus on another symptom that can quietly signal danger: difficulty breathing or sudden shortness of breath. Imagine sitting quietly, not exerting yourself at all, and suddenly feeling like you just can't get enough air. It's as if the room has gotten smaller, or the air is too thin to breathe properly. Why should you take this seriously? Shortness of breath, especially when it comes on suddenly or worsens over time, is a serious warning sign. It's your body's urgent way of saying something is wrong, often with your heart, lungs, or both. What could be happening? There are several critical conditions that cause this symptom. Congestive heart failure. Your heart struggles to pump blood effectively, causing fluid to build up in your lungs. This makes breathing difficult, especially when lying down or during simple activities. Pulmonary embolism. This is a dangerous blood clot that blocks blood flow in your lungs. It can happen suddenly, especially after long periods of sitting or following surgery. It often starts with mild chest discomfort and quickly escalates to severe breathlessness. Silent heart attack. Unlike classic heart attacks, these don't always come with chest pain. Instead, you may experience intense breathlessness, nausea, cold sweats, and fatigue, symptoms many overlook. Signs you shouldn't ignore: feeling breathless while resting or during light activity, sudden difficulty breathing without explanation, waking up, gasping for air in the middle of the night. Accompanying symptoms like swelling in the legs, dizziness, or chest discomfort. What should You do? If you experience sudden or unexplained shortness of breath, don't wait. Sit down, stay calm, and seek medical attention immediately. Especially if you notice any swelling in your legs or feet, chest pain, or dizziness along with the breathing trouble, it's time to get checked. Early diagnosis can prevent serious complications and save your life. Why seniors need to pay extra attention as we age. Our lungs and heart may not work as efficiently as before. Conditions like chronic obstructive pulmonary disease, COPD, heart disease, or blood clots become more common, so recognizing this symptom early is crucial. My modern and unstoppable seniors, if breathing ever feels harder than it should, take action fast. Your breath is life, and protecting it protects everything else you love. My modern and unstoppable seniors, now let's talk about a warning sign that might seem like a blessing at first, but is actually very serious: drastic and unexplained weight loss. Losing weight without trying can feel like a victory when you're younger, but after 60, sudden weight loss without a clear reason is a red flag that something important is wrong inside your body. Why does this happen? Your body is incredibly complex. When it's fighting illness or struggling to keep vital organs working, it can start burning through energy reserves without you realizing it. Some of the main causes include cancer. Certain cancers, like those affecting the pancreas, lungs, or digestive system, can cause rapid weight loss long before other symptoms show up. Cancer changes the way your body uses energy, burning calories faster than normal. Metabolic disorders. Conditions like undiagnosed diabetes or thyroid problems can speed up your metabolism, leading to unexpected weight loss. Heart failure. When your heart isn't pumping properly, your body can't get the nutrients and oxygen it needs, causing muscles and fat to waste away. Chronic infections and inflammation. Long-term infections such as tuberculosis or autoimmune diseases keep your immune system working over time, draining your energy and causing weight loss. Signs to watch for: your clothes suddenly feel loose without you changing your habits. Friends and family comment that you look thinner or more frail. You feel weaker or more tired than usual. You notice muscle loss or general weakness. Why should you act quickly? Unexplained weight loss can lead to frailty, increased risk of falls, and weakened immunity. It's a serious signal that your body is struggling and needs help. If you lose more than 5% of your body weight in a few months without trying, it's time to see your doctor for a thorough checkup. What should you do? Keep track of your weight regularly. If you notice a sudden drop, don't brush it off as just getting older. Ask for tests to find the cause and get the treatment you need. Remember, my modern and unstoppable seniors, catching these issues early can make a huge difference in your health and quality of life. My modern and unstoppable seniors, now let's discuss a symptom that often gets misunderstood or dismissed: sudden confusion or memory loss. While some forgetfulness can be a normal part of aging, a rapid or severe change in your mental clarity is a serious warning sign. It's your brain telling you something isn't right. What causes sudden confusion? Sudden confusion, disorientation, or trouble remembering recent events can be caused by several urgent health issues, including delirium, often triggered by infections like urinary tract infections or pneumonia. Delirium causes sudden and severe confusion that comes and goes. Stroke. When blood flow to part of your brain is blocked or interrupted, symptoms can include sudden confusion, difficulty speaking, or trouble understanding. Immediate medical help is critical. Low blood sugar or electrolyte imbalances. Changes In your blood sugar or minerals like sodium can affect brain function quickly, leading to confusion or memory problems. Medication. Side effects. Some medicines can cause cognitive changes, especially when started or dosages change. Why is this so dangerous? When your brain isn't working properly, it increases the risk of accidents, falls, and injuries. Confusion can also be a sign of infections or life-threatening strokes, which need urgent care. If you or a loved one suddenly shows signs of confusion, difficulty focusing, or forgetfulness that is unusual, don't wait. This is a medical emergency. What should you do? Take note of when the confusion started and any other symptoms like weakness, speech changes, or sudden headache. Call emergency services immediately if the confusion is sudden and severe. If it's mild but persistent, see your doctor quickly for tests to find the cause. How to protect your brain health. Stay hydrated and eat balanced meals. Keep up with your medications, but discuss side effects with your doctor. Regular checkups to manage chronic conditions like diabetes and hypertension can help prevent sudden brain changes. Remember, my modern and unstoppable seniors, your mind is just as important as your body. Sudden confusion is not something to ignore. It's your brain's urgent call for help. My modern and unstoppable seniors, the last warning sign we need to talk about today is severe swelling or sudden pain in your legs. This symptom might seem simple or related to tiredness, but it could be a red flag for something very serious. Why does this happen? Swelling or sudden sharp pain in one or both legs can signal dangerous conditions like deep vein thrombosis, DVT. This is a blood clot forming deep in the veins of your legs. It can cause swelling, warmth, redness, and pain. If a clot breaks free, it can travel to your lungs and cause a pulmonary embolism, a life-threatening emergency. Heart or kidney problems. When your heart or kidneys aren't working well, fluid can build up in your legs, causing swelling and discomfort. Infections or injuries. Sometimes infections like cellulitis or injuries can cause sudden swelling and pain, which need urgent treatment. How to recognize the danger signs. Sudden swelling that worsens quickly, pain that feels sharp, cramping, or throbbing, skin that becomes red, warm, or shiny, difficulty walking or putting weight on your leg. If you notice these symptoms, don't wait or try to walk it off. This isn't normal aging. This is your body telling you that something urgent needs medical attention. What should you do? Call your doctor immediately if swelling and pain start suddenly. If you experience chest pain, difficulty breathing, or rapid heartbeat along with leg swelling, call emergency services right away. These could be signs that a clot has moved to your lungs. Avoid massaging or rubbing the swollen area, as it may make things worse. Protecting your leg health. Stay active, but avoid sitting or lying down for long periods. Wear compression stockings if your doctor recommends them. Keep hydrated and maintain a healthy weight. Manage chronic conditions like heart disease and diabetes with regular checkups. My modern and unstoppable seniors never underestimate leggy, swelling, or pain. These symptoms can save your life if acted on quickly. Thank you for being here today and learning about these critical warning signs. Remember, early action can make all the difference. If you found this information helpful, please like, comment, and share with others who need to hear this message. Take care of yourselves, stay informed, and keep thriving.